Hello everyone, welcome back to our Nursing tutorial YouTube channel. In this class, we are going to discuss with hypothermia in newborns. Hypothermia in newborns, that is, hypothermia is a condition where the core body temperature of a newborn falls below 36.5 degrees Celsius, that is 97.7 degree Fahrenheit. Here the hypothermia is nothing but there will be the condition, that is body temperature below the normal level. And then here normal range, that is announced by the WHO, is 36.5 to 37.5 degree Celsius, that is auxiliary temperature. Next we'll see the classification according to WHO. Mild hypothermia, moderate hypothermia, and then severe hypothermia. We'll discuss it one by one. First we'll see mild hypothermia. Next, causes and risk factors here. That is environmental, physiological and medical. Here environmental comes under cold rooms, wet baby after birth, inadequate clothing. And then physiologically, that is prematurity, LBW babies. And then medical means sepsis, hypoglycemia, perinatal asphyxia, and then central nervous system depression. Here newborn non-shivering, thermogenesis by brown fat breakdown. Mechanism of heat loss, that is, here heat loss will be by conduction, radiation, convection and then evaporation. Here conduction in the sense, here direct contact with cold surface, for example cold mattress and all. And then radiation, that is loss of colder objects nearby, for example cold walls and all. And then convection, loss of surrounding air, for example it may be AC or fan. And then evaporation, that is loss from wet skin or clothes, for example that is after birth. Next we'll see the clinical features. Here mild hypothermia, that is cold stress. Here we can see baby is cold to touch, extremities cool. And then we can see lethargy. Lethargy is nothing but a irritation some kind. Lethargy, poor feeding and then weak cry. After that comes to the moderate hypothermia. Here we can see generalized coldness and then pallor, peripheral cyanosis. We can see the bluish discoloration and then respiratory distress, apnea we can see. And then hypoglycemia, that is jitteriness and then convulsions. Next one is severe hypothermia here. Here we can see stupor, hypotonia, bradycardia, apnea and then shock-like state. High risk of death here. These are the clinical features of mild, moderate and the severe hypothermia. Some important points added here, that is hand and feet are cold to touch, indicate cold stress. And then if the abdomen and chest is cold to touch, then that indicate moderate and severe hypothermia. Next we'll see the management for this. First we'll see the management for how to manage mild hypothermia. Here mild, it consists 36 to 36.4 degrees Celsius. And then here first point is that immediate skin to skin contact, that is nothing but a kangaroo mother care, KMC we can call. And then cover with warm clothing, cap, socks and blanket. After that keep room warm. And then frequent breastfeeding, it is must. This is all about the mild hypothermia. Next we'll see the moderate one. Moderate hypothermia, it is consists of 32 to 35.9 degrees Celsius. Here first we need to do is place under radiant warmer or incubator and then warm clothing should be, and then cover head and extremities. Monitor temperature every 15 to 30 minutes. It's an important thing. And then check for hypoglycemia and feed accordingly. Next we'll see the severe hypothermia. It is less than 32 degrees Celsius. Here first thing we had to do is immediate admission to neonatal intensive care, NICU has to be taken admission, and then warm gradually using radiant warmer or servo controlled incubator, and then avoid rapid rewarming. It may cause apnea or shock. And then warm IV dextrose and oxygen if required only. if required, and then monitor vitals, blood sugar and oxygen saturation, and then treat underlying causes. For example, it may be sepsis or hypoglycemia. Next, we'll see the main important part of this procedure is prevention. How to prevent? Warm chain practice. In that, warm delivery room, and then immediate drying of baby after birth, skin to skin contact, KMC is very important here, and then early initiation of breastfeeding, delayed bathing, and then appropriate clothing, warm transport has to be there, training of healthcare workers and mothers. This is all about the prevention of hypothermia newborn. Please like, share and subscribe to my YouTube channel for more informative content. Thank you for watching.